Hey guys, thanks so much for coming back to the channel. It is October, which brings us to Sudden Cardiac Arrest Awareness Month. So with that said, we're throwing a quick video together just to kind of talk about some general action steps that you can take in the event that we are experiencing or seeing being present where someone is experiencing a sudden cardiac arrest. A lot of the time, this is really relevant and important is because we have a misinterpretation of what sudden cardiac arrest actually is. So this is when the heart stops beating. It's typically unexpected. So we all think about like Damar Hamlin, for example, that we saw that happen on national television. And then a lot of the news reports later down the line were saying, oh, he had a heart attack. He had a heart attack on the field. It's actually not what happened. He experienced a sudden cardiac arrest. A heart attack is different than a sudden cardiac arrest, which is why we want to bring awareness to that fact by celebrating this month and making sure that everyone is trained in CPR, everyone knows how to do it at a very minimum, at least recognize there's an emergency, and then perform CPR after we activate the EMS system. So we always send out a little graphic here to all of our clients just to print out, put up in the office, at home, whatever the case is, that just kind of runs you through this general standard practice, which is what we refer to as our action steps when we see something happen, right? So we recognize an emergency exists, we decide to take action. It's a cardiac emergency because the person is unresponsive, they're breathing irregularly, agonal breathing, or they're not breathing at all, right? That means we're going to activate EMS by calling 911, and we're going to begin cycles of CPR. So we always have this little sheet here that we send out. Number one, identifying the age and size of an individual so we know what kind of care to give, and then also what care to actually give. So for CPR cycles, we're going 30 compressions and 2 rescue breaths. Remember, the rescue breaths are optional. You do not need to give breath if you're doing hands-only CPR. So what we're doing is we are compressing on the center of the chest across the anatomical nipple line of an individual, and we're going to compress at the rate of 100 to 120 compressions per minute. This is going to produce a high cardiac output, right? So moving blood. That's what we're trying to do, is move blood that remains in the body to the person's lungs and their brain so we can help sustain or maintain them until advanced support arrives. So again, bringing awareness to this is really important because we're seeing a big uptick in this nationwide. We want to make sure that we can feel confident when responding to these emergencies and know exactly what to do. So that's why we have our 3 C's, right? Check, call, care. Check the scene, make sure it's safe, call 911, activate the EMS system, begin care, which is a compression-only technique we use for hands-only CPR. So hopefully you guys enjoyed today's video celebrating Sudden Cardiac Awareness Month, Sudden Cardiac Awareness Day, which is October 10th. And make sure that if you haven't done so yet, sign yourself up for a CPR class, learn how to save a life. Thanks so much for joining.